Hello, my name is Aline Jackie Majou, a nurse practitioner since December 2020 and a student in a DMP program at University of Massachusetts Global. I'm going to present my stakeholder education plan for my clinical scholarly project for the following purpose: a brief description of stakeholder groups, each group's role in the project implementation, discussion of the theoretical foundation and conceptual framework, identification of education need for each group, and outline of a plan for delivering the intervention. Pre-diabetic is a risky state for the oncoming advance of type 2 diabetes mellitus. My primary function as a nurse practitioner is to decrease the risk of pre-diabetic adults having type 2 diabetes mellitus through primary and secondary prevention. Pre-diabetes and diabetes cost the country $366 billion annually in medical expenses and the cost of lost productivity. Pre-diabetes may be avoided through sport, decreased weight, and a healthy diet. Mobile health technology is a valuable and economical mode of providing pre-diabetes prevention program in a real-life situation. That leads to my clinical question. Does the telehealth education program reduce hemoglobin A1C among adults identified with pre-diabetes more than pre-diabetic adults who did not go to the program for 2 months? Let's talk about brief description of stakeholder groups. Stakeholder and individual or organization interest in or impact by quality measure. Stakeholders include pre-diabetic adults, the registered dietitian nutritionist, lifestyle coaches, diabetes educator, and advanced nurse practitioner. What is the stakeholder group role in the project implementation? Pre-diabetic adults will be actively involved in the work activity to assist the stakeholder in offering patient-centered care. Their engagement involves lifestyle modification with their favorite in the management plan. The participant agreement is vital to be proficient in implementing this project. The RGN will help select the diversity of beneficial nutrient and serving size to assist pre-diabetic adults control blood sugar level. RGN use medical nutrition therapy that contain nutrition identification and therapeutic and advising assistance to assist in managing pre-diabetes. Lifestyle coaches facilitate behavior change and stress management. The participants learn to gain the skill needed to make lasting changes. Diabetic care and education specialists educate and lead participants to comprehend they are pre-diabetic and how it touches their individual lives, and work with them for behavior modification purpose to ameliorate their well-being. The advanced nurse practitioner assess pre-diabetic adults, order lab tests, monitor participant weight, hemoglobin A1C, and blood sugar level, and teach them about their state. The stakeholder will collaborate to achieve excellence and a participant-focused plan of care. Let's talk about the theoretical foundation and conceptual framework. This CSP used the stage of change model, also called the trans-theoretical model, health promotion model, as a theoretical framework to develop the study to lead my opinion during the world project. The TTM focuses on increasing individual engagement, self-efficacy, and behavior changes through 6 stages of change. The TTM describes the person's willingness to modify their conduct and the process of behavior adjustment as happening in stage. This stage involves pre-contemplation. That means there is no intention of acting. Contemplation, their intention to act and a plan to do so soon. Preparation, there is an intention to act and some steps taken. Action, modify conduct for a short period, attempting the change. Maintenance, conduct has been modified and maintained continuously. Termination, there is no intention to return to previous negative conduct. Prevention is the most economical method in decreasing the hard occurrence of type 2 diabetes mellitus. TTM was used to assess participants' perceived importance, readiness, and confidence toward behavioral changes. TTM successfully assessed and improved individual progress in behavioral changes. TTM is not just vital to assist the stakeholder in comprehending the stage of personal change, it will also help find the best support and strategy that will fit the pre-diabetic individual during the transition. What about the educational intervention? Individuals accomplish their activity well when they are motivated. Change happens by supporting people to comprehend what the change is all about, the logic behind the change, and how the change will assist them in reaching their goal. The educational intervention's goal is self-efficacy, where the patient can self-manage their pre-diabetic status and the benefit they will gain. The essential educational intervention in this CSP involve conveying the project purpose and intention to the stakeholder, recognizing barrier to acquire information and educating them. Review are necessary to monitor observance and obedience to the education program. Now let's talk about the implementation plan. Applying TTM to promote the importance of lifestyle modification in pre-diabetic is expected to delay and prevent the development of type 2 diabetes mellitus. TTM encourages considering a person's readiness to change when implementing the SSR's goal and program. TTM advise avoiding recommended change that the participant will be hesitant to implement. Motivational communication strategy, suggesting goal, giving the right feedback, supporting good habits, and developing support network are well suited to the early stage of change and maintain the change. This concludes my presentation. Thank you for your time.